In this video, I am going to show you how I injected platelet-rich plasma or PRP into both knees of this patient. These PRP injections are being given as a booster dose to this patient who had earlier undergone stem cell treatment to both his knees 3 years ago. He has been doing fine. The last few months he has developed some mild discomfort and was anxious to improve his walking performance. I'm going to do this in my office under local anesthesia. Let's go to the procedure. This syringe contains 6 ml of platelet-rich plasma. I will be injecting 2 such syringes in both the knees of this patient under local anesthesia. Now we are preparing the skin. Now I am going to insert the needle into the right knee, and there is a effusion in the right knee. I will be aspirating the effusion and injecting PRP. Now you can take the PRP out of the machine. It's ready. Okay. I am donning sterile gloves after having cleansed my hands with soap and antiseptic solution. This is lignocaine, local anesthetic, just to anesthetize the skin. Now this is lignocaine and I am going to inject it. The superior, I will be injecting it from the top, kneecap, 1 centimeter above and outside. I am injecting the skin and subcutaneous tissue with lignocaine local anesthetic, so that you won't experience any pain. Okay. And on this side. Now the skin is anesthetized and I can inject the large diameter needle into the joint. I am aspirating effusion from the right knee joint, and you can see this gush. Plasma or PRP is injected intra-articularly into the knee joint, as you can see here. The knee is cycled a few times and a sterile gauze is applied as a dressing. Since he did not have much effusion in the left knee, I'm going to inject the left knee from the infrapatellar route. So this is the second lot of PRP. Another fresh needle, palpate for the femoral condyle and the upper margin of the tibia. Just a finger's breadth above the joint line. On the inner side you have the patellar tendon. The needle will go straight in. Sir. Okay, now the needle is inside the knee. Tolerable? Finished. Any pain? If you appreciate this procedure, you might wish to see how I injected the elbow joint with PRP in this video. As always, like, share and comment. I'll see you in the next video. Cheers.